Okay, so I'm going to provide a little bit of a video regarding Chapter 11 from your Claywell text. Chapter 11 is about the nurses, ideas, and forces that define the profession of nursing. So, for this chapter, we want to discuss the historical contributions to modern nursing, describe the impact of managed care and merging health services on the nursing profession, discuss the role of nursing in quality improvement to patient care, and describe at least 3 ways in which trends in healthcare will affect nursing practice. So, historically, nursing was considered a calling, and there was a large background of religion in the um, field of nursing. So, the earliest documented nursing organization was formed in 1099 during the First Crusade. So, they were known as the Knights Hospitallers of St. John of Jerusalem, and the organization's members provided hospitality and care to thousands of pilgrims on their way to the Holy Land. The Knights of St. Lazarus dedicated themselves to caring for people with leprosy, syphilis, and other socially unacceptable diseases. Then, during the bubonic plague in 1348, the Alexian brothers were founded to care for ill people. And that organization still exists today in the dual roles of both nursing and spiritual care. During the past several years, parish nursing has achieved a certain popularity, meaning many churches have instituted parish nursing as a service for their parishioners. And the duty of a parish nurse is going to change with each organization, each church, but it usually includes things like visiting the sick, teaching about health promotion, wellness screening for members. Parish nurses usually provide holistic care to a community of faith. So, Florence Nightingale is, of course, one of the most famous nurses, and we talked about her in Module 1, but here again we have some brief highlights of her contributions to nursing. So, she was a highly educated woman with a high social standing, and a lot of people may have considered, the duties associated with nursing to be beneath her. She could have done a lot less in life, and it would have been acceptable or expected even. But she chose to serve and to help people heal. So during the Crimean War, she is credited with decreasing the death rate from 42% to 2%. And she did this by managing the environment and keeping things clean. She was called the Lady with the Lamp because she would go around doing rounds on the battlefield. So the men fighting would see the lady walking around with the lamp, and that's how they identified who she was. She did establish a nursing school, and she wrote a textbook. She changed nursing to become a respectable profession, and she believed that nursing was an art and a science mixed, that it required organized practical and scientific training, but there was an art to the practice. So you're not going to need to know all of these different characters, historical characters for the test, but going over them and learning about them is how you can see that the field of nursing is in a dynamic relationship with what's going on in society. So Clara Barton was called the Angel of the Battlefield during the American Civil War, and she organized the American Red Cross, which of course still exists today. A woman by the name of Lillian Wald established a visiting nursing service for poor families in New York City. This was during the time when tenement buildings were increasing, so there were lots of people living in a small space, and infectious disease became a big problem for people. So she was helping poor families navigate illness. Next is Mary Breckenridge, and she organized a frontier nurses organization in rural Kentucky that is still in operation today. So obviously she was helping people who had a lack of resources. Linda Richards is known as the America's first trained nurse, and she established nursing programs, and she also established or organized the first system for patients having individual hospital records for while they were in the hospital. So we can thank her, I guess, for the modern American medical record. Next is Isabel Robb, and she reduced the working hours of students and promoted licensure exams, which of course would increase the safety for society at large. If you can pass an exam that demonstrates basic knowledge and understanding, then that will increase the safety for your patients and for society at large. Next is Mary Nutting, and she wrote a book on the history of nursing, which doesn't sound like much other than, if there's no book, then there's really no way for people to look back to something and to agree on a history of something that is important. Next is Lavinia Dock, and she was a well-known nurse who fought for women's rights issues and for the right to vote. So an all-around good person, right? Mildred Montague promoted creation of the associate degree as a shorter route into nursing, which is, of course, very, very necessary in order to meet the needs of society and our patients. So not only are there societal issues that affect the history of nursing and honestly the future of nursing, but there are also political issues. So many important contributions to professional nursing have been made during times of conflict, such as war. During the Civil War, Dorothea Dix was a Boston school teacher who had been crusading to improve the care of the mentally ill in institutions. Prior to Dorothea, there were oftentimes people were just kind of put away into an institution and they were not provided love or social interaction, and they were usually mistreated. There wasn't much oversight for the people that worked in those institutions, and oftentimes families did not continue to stay involved with their loved ones after they were placed there. Dorothea Dix also organized a training program for women volunteers to care for the wounded during the Civil War. During the Spanish-American War, the first trained nurses were accepted in military hospitals, so it's pretty exciting. During World War I, both the Army and the Navy had a nurse corps. In World War II, nurses were involved in all aspects of military care, including hospitals, battleships, and even flying on medical evacuation planes. During the Korean conflict, the Vietnam War, Operation Desert Storm, and the War on Terror all see nurses taking care of our troops. So, quick question, easy peasy. A nurse knows that Florence Nightingale is known as Angel of the Battlefield, first trained nurse in America, superintendent of the female army nurses, or Lady with the Lamp. The correct answer is Lady with the Lamp. So, as far as nursing today, the factors that influence our practice, first we have the aging population. And sometimes you might hear that called the graying of America, which means there was, a baby boom where there were lots of babies born in our history. And so now those people are aging, they're getting older, their hair is getting gray, and they're requiring, as a generation, they're requiring more resources from the healthcare field. So people who are working in nursing have to have a knowledge of geriatrics and home care in order to effectively do their jobs. We also have an emphasis on health promotion and disease prevention. And so a healthy role model is a strong characteristic of a nurse who's engaged in health promotion. Nurses oftentimes are expected to counsel or teach patients about health screening, dietary needs, exercise programs, treatment regimens, and self-care. And you'll notice the role of the RN has absolutely expanded, that we do much of the teaching that patients receive. We also provide outcomes-oriented, patient-centered care. And so you'll notice that when we do the nursing process, we assess our patients and then we identify outcomes, right? It's like step 2 of the nursing process that we talked about in module 1. So we really, really focus our interventions based on the outcomes that we've identified. And our care plans should be collaborative with our patients. So we provide outcomes-oriented, patient-centered care. Nurses work with population groups as well as individual patients to develop health-related goals, and nurses play an important role in helping to achieve positive experiences. Oftentimes, one thing that dictates what we do the most would be the financial reimbursement for what we want to do. So it's considered cost containment from a business perspective. And for that reason, we have what's called managed care. So it's an insurance-based approach to reducing costs. And what it means is that patients who will come to the hospital will have their medical record reviewed, and a special coder will assign a code to the medical record based on what the doctor has documented. And the line, like, excuse me, I messed up my words there. There's a large number of medical diagnosis codes, and they're grouped together based on the amount of money that it will cost to treat those diagnoses. So oftentimes you'll get a bill and it might have different codes on it. You could look those up on the internet and see what DRG your code belongs to. Also, preferred provider organizations impact how cost is contained in healthcare. They're also called PPOs. So patients will often receive a discounted rate for services if they use certain physicians or agencies. Next, cost containment occurs through health maintenance organizations, and it's a group healthcare agency that has a prepaid fee. Oftentimes, HMOs will require you to have a referral from your primary care provider in order to see a specialist, whereas like a PPO may not require you to see your primary care provider before going to a specialist. What I found in my personal experience having a PPO is that I may not always need to go to my primary care provider to get a referral to a specialist from the insurance standpoint, but oftentimes specialists will require a referral or at least documentation of previous healthcare provider records that would indicate that you do actually need to see that specialist provider, or else I guess a lot of people would be wasting their time, huh? Another aspect of managed care would be Medicare. So that's a national and state health insurance program for older adults. And they work on a prospective payment system, which limits the amount of money that is paid to hospitals based on those DRGs code, those medical codes. And so oftentimes your private insurance companies will work a contract so that they get reimbursed in a similar way to Medicare. But basically, the payment is based on a DRG code, not the actual cost of caring for a patient. This is why so many times your hospitals are highly invested in you avoiding complications for your patients, because the Medicare or insurance company may often only allow a set amount of dollars to provide care for that patient. And once that money runs out, they're not paying you any additional money. So if the patient has complications while they're in the hospital and they have to stay longer for those complications to resolve, then that care is not covered. The costs of that care is not covered. Anything over and above the expected length of stay for the DRG that was coded on the patient's medical record. Medicaid is a federal public assistance program to assist those that have financial needs. And that is not age dependent. Switching gears a little bit to quality improvement and safety. So we want to provide quality care, and the way that we do that is to perform continuous quality improvement. And it's a process in which the quality of patient care is continuously monitored for effectiveness. I mean, it's in the term, right? Continuous quality improvement. So this means that there are oftentimes registered nurses and other staff assigned to assess and monitor anything that affects patient care. So then they produce standards that will produce excellent outcomes, positive outcomes for the patients. And they will sometimes create clinical care pathways or care paths. And that just kind of helps healthcare professionals provide a singular path, a way to get better and improve and get discharged home. So hospitals will monitor the quality of care. Oftentimes nurses are hired as outcomes managers, case managers, and QI managers. The Joint Commission actually has established a set of core measures for certain disease processes. I myself worked as a core measure nurse in the past, reviewing records and working with department heads in order to change processes that would allow them to better meet the core measures. The Centers of Medicare and Medicaid Services created hospital quality initiatives, which are 20 measures of evidence that best practice is happening. Also, there's a group called the Leapfrog Group, which collects and reports patient safety and quality data to the public and payers. And you can typically look up a lot of that quality type information online. So you know whether or not the provider or facility that you're going to use is known for positive outcomes. So the Bureau of Labor Statistics indicates that registered nurses' job outlook between 2018 and 2028 is expected to grow by 12%. So we're like right smack dab in the middle of that. And it says, which is much faster than the average job growth rate. It's expected that the profession of nursing will need to add approximately 203,700 nurses each year to fill new positions and replace those that are retiring. So there's the Patient Protection and Affordable Care Act, which this government act increased the amount of money that was available to nurses who were furthering their education into masters and doctorates. So they would have grant money to help pay for their education. Nurse Faculty Loan Program also helps nurse educators, again, pay for the education to get to that level. So that way we can increase the number of advanced nurses, both in practice and in education, so that we can increase the number of students that we have, so we can increase the number of nurses that we put out there to work. Next, we're going to talk about nursing's social covenant. So the ANA Nursing's social policy statement states that nurses provide a caring relationship that facilitates health and healing. We are here to help the patients get better, right? We pay attention to the range of human experiences and responses to health and illness within the physical and social environments. We perform integration of assessment data with knowledge gained from an appreciation of the patient or the group that they belong to. And also, there's advancement of professional nursing knowledge through scholarly inquiry, meaning that we are curious and we aim to know what we can do to improve care. So the ANA basically states that we participate in the health of society, and these are the ways that we do that as a profession. Here's another practice question. It's the last one, actually. A nurse is discussing DRGs, PPOs, and HMOs. Which concept is the nurse describing? So this is a basic style question. You won't actually see questions like this on your exam. I think this is just a little too basic, too much at the knowledge level. You're not having to apply really any information. But the options here are core indicators, cost containment, hospital quality initiative, and nursing's social policy statement. And so obviously the correct answer is 2, cost containment. All right. Thank you for listening. If you have any questions about this content, please feel free to contact me or your local instructor. Also, please note that reading the book is going to be helpful, and you don't have to memorize the contributions of the historical nurse figures to the profession of nursing.